you've got a grey bin, you can put in paper like... The only one I wouldn't put in is if anyone has the next directory, because that's got a hardback on it, like a hardback book. So it's cardboard and the paper together.
Health in Mind was a programme that was established and it involved 5 different but connected projects. It's about testing out new ways of working with older people with mental health needs within the district, and it's about seeing whether those new ways will make a difference.
For us in Bradford, it's been about making older people's mental health everybody's business, in that recognising that it affects a lot of older people, but actually trying to have a very positive approach to that. And Health in Mind has really been about trying to keep that focus, really, to provide specialist support to help somebody with a mental health problem, but also to provide that kind of wider social network of support to help people to manage and to have a happy life.
We set out to improve the quality of life and experience of older people. We set out to reduce the number of circumstances where people might unnecessarily be admitted to care homes or into a hospital situation. We set out to intervene when older people with mental health needs had a crisis. We also set out to develop capacity in local communities in the third sector to ensure that older people had a much greater range of opportunities to meet others, to do things, to have you know, a real chance to sort of come out of home and their sense of well-being be improved.
A lot of the projects have looked at the multicultural side of it and actually introduced health in mind to different parts of society, which has been quite interesting as well, and obviously to see develop their knowledge as well, because a lot of people don't even speak English. So I mean, in order for them to find out in their own language, you know, their parents aren't just losing it, that it can be diagnosed and they can get support for it. It's obviously peace of mind for these people out there that have been trying to work with this for ages.
By actually working with, involving, encouraging older people to participate, their sense of feeling connected, their sense of being positive about themselves has increased. That there's evidence that that has happened, and I describe that as actually older people feeling loved. So we have brought a greater sense of love to a lot of older people through the programme.
Well, the Wellbeing Cafes are something that's quite different in the way that we want them as far removed from daycare or respite services as possible. It's all around trying to give people information. So we've got Kate here today who's doing the recycling.
As long as they're fairly clean, that is fine. So it's those types of cans.
Also, we provide entertainment, so it's a nice social outing that people can come through as a couple, especially couples who have one of the partners who've got dementia. It's a lovely social outing for them because we have entertainment, we have singing and dancing, and people thoroughly enjoy themselves.
My name is Gordon Alderton. This is my wife Eileen. We have been married for 57 years, and at this point in time Eileen has a little problem in terms of memory, and I'm doing my best to look after her, but we're trying to do it as a team. And this is like coming for a recharge on the battery. This is really a recharging point for both of us, both for me and for Eileen, and I can't say enough about it.
It keeps you want to have something to put on that's decent and perhaps up to date, and things like that. And it's amazing, you know, what you leave. Oh, I'm not putting that on, you know. And you go out and you see things, and you think, I'm having that, you know, and I tell him I'm having that. You know? I don't say, can I have it? I say, I am having it. And it's, you know, but it's funny. You can bring things out that you've had for donkey's years. I was trained as I don't know if I've forgotten now.
A tailoress, love.
Tailoress and dressmaker. And I've only got one sister. I mean, I don't go out and buy a short thing and then, a year or two after I'm shortening it. And I've let hems down. And believe me, my wardrobe's full of stuff like that now at my age.
Yeah, I've no room for my suits now. I have to put mine on a box on the floor, you know.
Having a mental health problem shouldn't necessarily mean that you have a poor sense of well-being. People can have quite a progressed dementia, but if those other elements are in place, then that can really help them to continue to support and manage and help their families as well.
I think it's also important to ensure in relation to dementia that you work with people to enable them to manage their condition. So it's enabled a number of people to perhaps remain at particular points along the journey for longer than otherwise might have been the case.
My role is to organise the staff to go out to people in the community who have mental health issues, to support them through their difficulties. In the home environment, they know the surroundings, they feel a lot more comfortable, and it's also beneficial for family to see them relaxed.
I don't want any, actually.
It's nearly 5:30 now.
I'm not used to being ordered about in my
Although they may not want the service at first, and that there's, they feel there's nothing wrong with them, they get into a routine and they get used to having people being with them for a time, and they start to eat again and generally blossom.
Look at this.
All right.
You like that?
All right.
We knew that in terms of the changes that we wanted to make, with the resources available to us, it might take 8, 9, 10 years to bring about those changes. POPs enabled us to accelerate a programme and get to test out those ways of doing things differently much sooner.
Now I can't find my way, can't find my way home. Oi! Brilliant. Well done.
It's awkward.
No, it ain't.
Is it awkward?
No, it's Keithley.
Is it Keithley?
Yes.
Oh, sorry, I made a mistake.
She's my wife, and we've been together 59 and a half years. I look after my wife as long as I can do it. I try to just do everything in my own way, and I mean, I'm no spring chicken, but I just do everything, don't rush anything, and we get through. See, what used to take 2 minutes like now takes 5, so to speak.
What?
What I do?
5 what?
Minutes ordering. No, that's right,
yeah.
well, that's right.
Sorry.
And when I come to these places, it's a change. And they're all lovely people. Otherwise, it's lonely. But when you get among folk, it's, it's great. You're not forgotten.